Am I
We are
okay?
live. Yes, we are live.
Fair enough.
Hello, everyone. I hope you all can see us. Please let us know in the comments if you can hear us and see us properly. Let me check on Facebook whether our live stream is visible. If you're watching, please let me know in the comments that you can see us. Hit the like button and let me know. So we have two viewers. Please let me know in the comments if I'm audible to everybody. Hi, hello. Yes, we are live. Welcome to yet another interesting session just with SuperBottoms. Please let us know which city you are watching us from, and please let us know if I am audible to everybody. So, welcome, tribers, to yet another interesting session just from SuperBottoms. Today, we have a very interesting session, and we will be discussing the topic of how to manage fever in children. We have with us Dr. Amit Gupta. He's a
Hello.
neonatologist and a pediatrician in Motherhood Hospitals, Noida, and he has an experience of 18 years in this field. He has completed his MBBS from GSVM Medical College, Kanpur in 2001. He has done his DM and MD Pediatrics from King George Medical College in 2006. And he has a fellowship in pediatric critical care from Max Hospital, Saket in 2010. Further, he went abroad to do a fellowship in newborn critical care from Canada. He is a member of the Indian Academy of Pediatrics and the National Neonatology Forum. Some of the services provided by the doctor are growth and development, including general pediatrics, balance exercises, child development disease treatment, immunization advice, and immunizations. He is currently heading the critical care department of pediatrics at Motherhood, Noida. Welcome to the session, doctor.
Thank you. Welcome to all.
Yes. Thank you so much for sparing your time and being with us here today to answer all our queries. So, doctor, the first question let's begin with, because as parents, we all know that when our child is unwell and our child has fever, all the entire family is distressed, not just the parents. So, could you please share some opening thoughts for the session on how we can manage fever in a better way as a family?
Shweta, so nowadays the days for fever is going on. Every other child in the family is having cough, cold, fever. And it is
Yeah.
quite usual for parents to get panic when the child is having fever. रात के 2 बजे child is having 102 fever, calling doctor. Yes, my child is having fever. Yes, everyone panics. I am a father of two daughters, so I will also panic even though I am a doctor. So just remember one of the things: fever is our helper and not a foe. Fever tries to help us to fight the infection. Fever is our body's general defense against the infection, whether it is viral, whether it is bacterial, whether due to any cause. Don't get panic with fever. You should. The reason for doing this session is to create an awareness what you are going to do when your child is having fever. No panicking, just follow the simple steps which we are going to discuss, and I am sure your panic level will come down after this session.
Right. So, what are some of the do's and don'ts that we should follow while our child is having a fever?
So always remember, once your child is having a fever, we all have a general tendency that we overwrap the child. ठीक है ना? So first thing, this is also one of the myths in fever, that whenever the child is having a fever, please don't wrap up your child. रात दोपहर को 2 बजे अचानक से मेरे पास फोन आता है, my child is having fever, doctor, what should do? Child is only 5 days old. When a child is less than 3 months of age having fever, we as pediatrician get panicked, because child usually less than 3 months of age, whenever have a fever, it should be investigated. So first and foremost thing I always ask my parents, क्या आपने बच्चे को लपेट तो नहीं रखा, क्या आपने बच्चे को ओवर रैप तो नहीं कर रखा. This is small small things you need to make sure. If the child is not over wrapped, if the child is active, please make sure that possibly this is not fever, it is just an environmental temperature which the child is having. Now if you really feel now, even after unwrapping, the child is you feel is warm, then please measure temperature. You can use those digital thermometer, or you can use the rectal thermometer or the oral thermometer. These all are methods available. Less than 3 years of age, we generally say it's a rectal thermometer to be used, but for our convenience, for your convenience, rectal might be difficult, so just an armpit temperature to be used. Now goes why when you should say my child is having fever or not. A child, when unwrapped properly after 10 to 15 minutes, take an armpit temperature. If the armpit temperature is more than 99, or for a child who is more than 4 years and having an oral temperature of more than 100, this is considered at fever, otherwise not. Whenever you get fever, please don't panic. Make sure you have couple of simple medicines like Tylenol or Crocin at your home, or Advil or Ibuprofen at your home, so that you can give in the proper dose as advised by your pediatricians. A child having fever, make sure the environment is cozy. Environment is not too hot, not too cold. It should be just a cozy environment. Let child wear a simple layer of clothes. Don't overwrap the child. Don't underwrap the child. These small things will make sure that your child is comfortable, is not panicking, and the fever will be taken care of by the medicines easily.
Right. Doctor, often we see that the child develops uncontrollable fever during the night time rather than the daytime. So often the children are very playful and active during the day,
This is
but
the reason we get most of Shweta, this is the reason we get most of the calls at night only.
yes, yes, very true.
Anyway, so there is a definitely biological mechanism. Why do we get more fever in the night time? We all have a hormone named as cortisol inside our body. During daytime, this cortisol is level is high. This cortisol level is high, and this in fact suppresses our immune system. So hence, since the immune system is not fighting with the infection during the daytime, the fever is not that much. But once we sleep, or once in nighttime, this cortisol level comes down, our immune system gets more active, and then we fight more with the fever. So this is the reason fever happens more in the night time. Simple second case, during the daytime child दौड़ा भागा and रात में थक गया. This is also one of the contributory factor. Apart from cortisol level, child getting more active in the day, रात में थोड़ा थक जाए, and this is the reason they get more fever in the night time.
Right. Okay. And sometimes at night, when we give the child some medicine, despite that, if the fever continues, then we are often advised to do sponging to our child. So, could you please share the right method and the right time to sponge your child?
Shweta, the sponging is a very important part of decreasing the fever. But it should not be in the Bollywood style. Bollywood में बुखार आया तेज, आइस पे लेटा दिया, और सिंपल ठंडा पानी लेकर उसका पट्टी कर दिया. So please don't do like this. It should be in a what you should do is basically a tepid sponging. What I mean by tepid sponging, you should do a sponging in which the water is not too cold, not too hot, and it should be just lukewarm or simple tap water which you can use. जनरली पूरी बॉडी को नहीं क्लीन करना होता, हाइड्रेट नहीं करना होता. व्हाट यू कैन डू, यू कैन यूज द एरिया विच आर यूजुअली वेरी हॉट, समथिंग लाइक head, forehead, something like an armpit, something like hands, something like a feet, and these are small areas which you can do. You should try to do in bits and pieces. 2-3 मिनट किया, wait किया, let it evaporate. It will help to temperature to come down, then again do it. So in bits and pieces you do it. ऐसा नहीं हो कि आपने तुरंत बच्चे को बुखार तेज है, दवाई नहीं काम कर रही, आपने उसको शावर करा दिया, उसको पूरे ठंडे पानी से नहला दिया, then the child will shiver out, and then in that case the fever will take time to come down. So just with a tepid sponging slowly in bits and pieces is the correct method of doing this decreasing the temperature.
Right. So in our community, when we posted about the session, we had this question saying, is 102 degrees fever high for a child?
Yes, if I, as a pediatrician, if I am not a pediatrician, definitely I will say 102 is high. But as a pediatrician, I will say 102 is a moderate fever. High temperature by test book is when the temperature is more than 103.4 or something more than 104. But yes, 102 is supposed to be a high fever. You should always let your doctor know my child is having 102 fever. Again, the same pattern goes when the child is having a high grade fever. Please don't panic. Make sure child is taking good rest, good sleep, along with paracetamol. Do a tepid sponging. Make sure child is wearing cool. Child is in a cool environment. Just wearing one or two layers and not overwrapping the child. These small things will help your child to get the fever down quickly.
Okay. And often we see that when the child is unwell, the children tend to not eat very well through the day. So how do we manage that? Because we don't want our children to
Quite
dehydrate
common.
and we
See,
want them
it,
to eat
it is
also.
quite Shweta, it is quite common. When we have fever or our child is having fever, we don't eat. We generally don't have a tendency to eat. हमारी भूख मिट जाती है, then they are small kids. So always parents say, मेरा बच्चा भूखा है, क्या मैं दवाई दे दूं? Child is not eating out anything. I tell my parents, just relax. Give crocin as of now. Once the fever start decreasing, start giving something to your child. Whatever eat, whatever drink, थोड़ा बहुत उसको देते रहो. Maybe not in bulk, but a small frequent meals to be given, or small frequent sips of water, or any fruits or juices can be given in small bits. So don't panic for it. If it's quite normal that child don't eat, but make sure small bits and pieces में उसे खिलाते रहो, जिससे कि at least hydration भी maintain रहे and the child should feel related too.
Right. Okay. Okay. We have a question that says, what other symptoms along with fever should be alarming to us as parents?
Yeah, when you are not fine, that specifically the age matters. If a child less than 3 months is having fever, which is a documented fever, मैंने बताया the child should not be overwrapped. Apart from overwrapping, if a less than 3 months of child is having fever, please see your doctor. If the child is having persistently high fever, 102, every time you have to do a hydrotherapy, उसको sponge करना पड़ रहा है to get the fever down, please see your doctor. Child is extremely lethargic, child is not eating, child is vomiting, child को suppose करो seizures पड़ता है, or child is very irritable in fever or having a very bad cough. These are couple of signs and symptoms when you should see your doctor. Always remember, don't panic. Your doctors are always a phone call away. They will be always there to help you out in any circumstances.
So the
Yes,
next
Shweta.
question is, after giving medicine, when the fever subsides, the kid sweats. Should we keep fan and AC on at that time? Also, should we
I'm
keep
not getting
AC
it.
at... I'm not
I'm not
audible.
sorry, Shweta, I'm not getting your voice clearly.
I'll just repeat the question. After giving medicine, when
Yeah.
the fever subsides, the kid sweats. So at that time, should we keep the fan and AC on?
So, yes, when the child is sweating, he is already losing temperature. Remember this thing. Since he's sweating, the temperature is coming down. At this point of time, you don't have to overwrap, you don't have to underwrap also. You know? Allow just the child should be allowed to wear loose clothes so that at least a proper evaporation can happen. First thing, no need of opening the AC because it will make the child shiver more. But yes, a cool, comfortable environment should be there to allow child to evaporate easily and the fever to come down nicely. So AC should not be there, but yes, a cool environment. Maybe you can just open up the AC in at 28 or 27 degrees centigrade, depending on your room's size, but it should be cozy and comfortable.
Right. Okay. The next question is, bathing is okay for baby or not in fever?
So as I said, bathing wala concept khatam. It is not a Bollywood style or a Hollywood style. When your child is having a high grade fever, Along with fever medicine, just do tepid sponging, which means bits and pieces sponging, that too on the area which are really hot, like head, like palms, like soles, like armpit, a little bit on the chest. Do it in bits and pieces. बच्चे को पूरा shower ले जाकर नहलाने वाला system, please don't do it.
Also, like in general, we have now given medicine to the child, and the child is doing okay now. So, during the day, is it okay to bathe your child as a routine?
Yes, you can bathe your child. The child is sweating out a lot, a little sponging or a little bathing is totally okay. This actually helps the child to usko body bhi achhi ho jati hai and then they feel okay. But make sure if the child is extremely dull, extremely lethargic, then don't do it. If he's active, he's looking fine, in that case, you can go ahead with the same.
Okay. Is it true that school going kid falls sick often? My daughter keeps getting fever every 3 to 4 weeks.
Yes, this is totally normal. It is the national statistics, not my statistics. A child in the first year of life, first year of schooling, they generally get 6 to 8 episodes of cough and cold, 3 to 4 episodes of loose motions a year, and that is quite normal. Remember, this is the nature's way of making them immune to different diseases. हम सब लोग अगर स्कूल नहीं गए होते तो हम सब लोगों को कफ एंड कोल्ड नहीं होता, हम सब लोगों को आज भी लगातार बार बार कफ एंड कोल्ड होता है. आई एम अ डॉक्टर सीइंग लॉट ऑफ पेशेंट्स ऑफ कफ एंड कोल्ड, टच वुड, आई एम फाइन, ठीक है ना. The same thing happens to your kid. Once they get exposed to different viruses, they build their own immunity. The body builds the immunity. The body remembers those viruses. And try to boost our immunity in long term. Mummy papa coming, my child's immunity is very less because he or she is getting sick, हर 2 महीने में sick होता है. I say please, it is a nature's call. Just make sure your child eats well, your child sleeps well. Spend less time on television or screen, spend more time on playing time. Have more of a curriculum which is more favorable for physical activity. These small things will help boost your immunity. Media is hyped with lot of things. Please don't need up all these things. The child only needs you and your time and a good surrounding to have a good immunity, and this will help them to make a good immune for the viral things.
Right. Right. The next question is, can we give all fruits curd when they have fever, cold, and cough?
Yes. It is a very common question. See, a child is having fever, he is not going to eat much, you know. So please give him whatever he likes, whatever he likes. It is a rule of thumb. दादी अम्मा नानी अम्मा कहती हैं इसको बुखार है, प्लीज दही मत दो. Please, there is no research. In fact, remember, curd is lot of probiotic. It is very good for body. Please give it. बच्चे को खांसी ज्यादा है, कर्ड मत दीजिए, प्लीज. रॉन्ग मिथ. Give curd, but it should not be chilled. A room temperature curd should always be given. Ask child what he wants to eat. I am okay with my child having chocolate, chips, or anything while he's having fever. At least something should go into him. Something, one or other thing in form of liquid should be given, because it helps to hydrate the child and maintain energy.
Right. The next question is, my child has mild adenoids. So, is it true that they will get cold and cough very frequently?
No. Adenoids is basically why this child is having adenoids. Adenoids is like a form of tonsils only. We have tonsil out here. The same thing is a general body defense mechanism, which is there, a form of lymphoid tissues which sits at the back of our nose. So if a child is having a recurrent cough and cold, these adenoids get enlarged a bit. Okay, na? A bit is okay, a mild to moderate is okay, but when this adenoids is more, it's a hypertrophy, a grade 3 or 4 adenoids, causing partial impingement on our airways. This leads to child getting more prone for infections, like for cough and cold. So how do we recognize this? This child who's having a big adenoids, they usually sleep with their mouth open. They do lot of snoring in night time. उनकी रात की disturbed sleep रहेगी. So when you have these symptoms and your child is having a recurrent cough and cold, do ask your doctor whether there is a need to do an x-ray, and if yes, there is a grade 3 or 4 adenoids, maybe the child needs treatment for it.
Okay. The next question is, can kids sleep immediately after eating during fever? Will it increase the temperature?
No, there is no correlation with it. ठीक है ना? No, seriously, no correlation. A child is, at least I am lucky. I will be lucky enough my child eats during the fever. वो सो जाए, it's all good. This is going to help him. So at least he will take rest. Remember, rest is always an important component to decrease the fever. खाना खाने के बाद बच्चा सो जाए, please, it's nothing better than that. Let him sleep. Don't ask him to wake up. He's sleeping, taking proper rest. Please, good enough. Go ahead with it.
My kid coughs at night. What can be the reason for this and how can we control this?
So majority of the cough in the daytime is not worrisome. In the night time, when we have to sleep, our child coughs a lot. ठीक है ना? First thing, in the daytime, the gravity is playing a role. Child is standing or sleeping or walking around, so the gravity plays a role. All this phlegm and everything just gravitates down. But in the night time, when the child is sleeping, this phlegm is not coming down. You know? So one of the reason why this cough more is this gravitational role. Second thing, there is a temperature difference. So in the night time, there is a cool temperature, which actually increases allergic cough, asthmatic cough more. So these two factors these two factors are the known causes for having more cough in the night time. Please don't panic. Make sure your child, whenever he's having cough, give a little lukewarm water or a little honey. Make sure your child get the head elevated so that he sleeps comfortably. Gravity plays a role. You can use a mist or a room humidifier to make sure the temperature is calm and cozy. These small things will help you to decrease the night frequency of coughs.
Okay. Do the health drinks really improve child's immunity?
I'm sorry. I'm a big no doctor for all these things. All these things are media hypes. ठीक है ना? They are during COVID time. Lot of these things comes up. Immunity boosters or health drinks and all those things. Agar ma'am, everything like this health drinks happens, then in this world, no child will become sick. Please, there is nothing like health tonic or anything. Remember, your time, less of screen time, more of play time, lot of sunshine exposure, lot of healthy eating. This is the root thing for good immunity. All these things are just mental satisfaction. Please make sure spend quality time with your kids, play with them, engage with them, let them eat healthy, be a role model for them. This is what you want and nothing else.
Right. That's such great advice. I mean, of course, as parents, so much of media exposure, we tend to get carried away so many times because every time those ads keep bombarding in front of us and we get confused at times whether what to believe and what not to believe.
Seriously, we all get influenced by a lot of with the social medias. So I always say, please use your brain whether these things are really helpful for your kid or not, and then decide about it. Don't get influenced by all these things.
So, doctor, at the end of it, do you have any myths and facts about fever that we have not yet addressed?
I think majority of the thing I will just recapitulate. Your child feels warm, ठीक है ना? Feeling warm is fine. You just unwrap your child and find out whether this child is having fever or not. Remember, your fever is your friend and not a foe. It is actually helping your child to fight the infection. We usually think कि बुखार की दवाई दे दी, why the fever should go off. Remember, a viral generally takes 3 to 4 days. So you have to give fever medicine again and again. ठीक है ना? Once the medicine effect goes off from the body, there is a tendency for fever to rise again. So don't get panic. By third or fourth day, if the fever is not coming down, please see your doctor. There is no doubt about it. Remember, high grade fever does not lead to seizures. ठीक है ना? कुछ बच्चों में दौरे पड़ते हैं. It is only generally into approximately 2 to 3% of the kids who usually get fever with seizures with fever. उनको दौरे पड़ते हैं, but they have a general tendency. And remember, whenever there is a febrile seizures due to fevers, this is safe for your child. There is no side effect. It is, yes, panic for us to see, हम लोगों को डर लगता है, but remember your child's brain is fine. So don't panic about it. ठीक है ना? I think these are small bits and pieces I would like to advise.
Great. Thank you so much for these nuggets of knowledge that you've shared with us. I'm sure all the viewers have taken away so many insightful tips from this session. I would like to extend the gratitude towards you for taking out your precious time and being with us here today in the session. Thank you so much.
Thank you, Shweta. Thank you, all of you.